You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org. Building Sustainable Healthcare Homes is a new podcast series showcasing AAPCHO's Cultivating Traditions of Wellness 2010 Conference and Gala on February 23, 2010 in Washington, D.C.
In this episode, conference keynote speaker Dr. Howard Koh, Assistant Secretary for Health in the Department of Health and Human Services, speaks on the timeliness of the conference and the inspiring efforts of AAPCHO and other community health center leaders.
It's so wonderful to be here and to see this wonderful group because I have so much in common with you. First, you know that I am the Assistant Secretary for Health, or what they call the ASH. But I was reflecting that this conference in many ways captures so many of the themes that have been important to me in my personal and professional career. First of all, I am from a Korean-American family, and my parents were immigrants to this country searching for the American dream. And when you become the ASH and get to serve your country, you get very reflective about your life and you think about your journey. And so I think about my parents' journey a lot. My parents told us almost every day how important it was to value our traditions and how important it was to give back and to dedicate ourselves to service. And in many ways, I am standing here because of the sacrifices of my parents and my family, and I know that you feel very much the same. I also think about AAPCHO and the Community Health Center movement in special ways because I am from Massachusetts. And you know that the Community Health Center movement started in Massachusetts, and a key leader in that movement was my mentor, Senator Edward Kennedy. And I think about his legacy, too, when I stand before groups like AAPCHO. And then I want to tell this group that when I look at the public health landscape and I think of all the people trying to make a difference in health, it's the people in the community health centers that really get it, who really understand the issues and have sacrificed and have served, like all of you, for many years. And whenever I visit a community health center, I can feel the passion and the service and the dedication that AAPCHO and other community health center leaders have exhibited year in and year out. If you want to go to a site that really understands how to integrate medicine and public health in a very vital way, it's at the community health center level. And I want to thank you and AAPCHO for your dedication, your perseverance, your sense of service, and for your commitment to cultivating traditions of wellness and building sustainable healthcare homes. We have many traditions, and one should continue to be respect for health and a dedication to a real mission for public health throughout our country, regardless of racial, ethnic background. I feel that very strongly every day in my service as the ASH, and I have lived that as a Korean American. I am thrilled that community health centers across this country now serve over 17 million people in need. I'm also thrilled that the President has proposals for investing more than $11 billion in community health centers over the next 5 years to continue to strengthen the community health center movement. We need a collective community-based approach, a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. That's what true health is, community health is, and that's what we try to provide. That's what you try to provide through the community health center organizations, through your healthcare homes, and through conferences like this. Through all this, we know that we have to continue to invest in community health centers. Many of you are healthcare providers here, and when you see patients suffering, preventable suffering, and dying preventable deaths, as I have, you start saying to yourself, there's got to be a better way. And the better way has got to be through a stronger respect for traditions, because we stand on the shoulders of those who came before us, and we lead the way for those who come after us, and especially a commitment to the sense of service that is exemplified in the most inspiring way by AAPCHO. I want to share with you this quote from Martin Luther King that I think about every day, and it's about service. And he said, "Everybody can be great because anyone can serve. All you need is a soul full of grace and a heart generated by love." And that's what AAPCHO has done year in and year out. So thank you very, very much for having me today. Thank you very much. Thank you.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.apcho.org and tune in for our next podcast at www.aapcho.org.